Hi, I see you're in for a physical for your job today?
Yes.
Okay, well first we're gonna start by just answering a couple questions. Alright, at this point I would be taking a general survey of the patient while we went through all the questions. I would look at the patient's age on the chart, see if he appears that age. I would look at his level of consciousness, see if he's alerted ×3. Then I would be looking at his skin color, seeing if he's flushed, pale, anything like that. I would look at his nutritional status. Does he look like he's undernourished, overnourished, or overweight? Then I would look at his posture. Does it look like he might have scoliosis, kyphosis, anything like that? If I helped walk the patient back, I would be looking at his mobility, his gait, use of assistive devices, things like that. See if he has good range of motion of his joints, or if he used, if he has any involuntary movements. Then I would also, at the same time, be looking for physical deformities. Did he use, wheelchairs, is he missing a limb, things like that. I would be looking at his facial expression, seeing if it fit our situation, is appropriate, to being here in the hospital. Make sure his face is symmetrical. Then I would also be looking at his mood and affect. Does it appear to be the affect that a person would have when they were coming to the hospital? Did he seem overly happy, or overtly sad, things like that? I would, while I was talking to him, look at his, or listen to his speech. Is it articulated? Does he have a good vocabulary? Is it slurred? Just an overall assessment of that. End of his hearing. Does he say what a lot? Is he understanding what I'm asking him? And then I look at his personal hygiene. Has he showered recently? Is there any body odor? Clean nails? Things like that. Alright, so then my first step would be to do the measurements and vital signs. The patient would still be in their clothing at this point in time. We would move to the gown later. So I would have the patient move over to the scale and I would weigh them at this point. I would also check their height. You can also ask the patient just to verify that they're aware of their health status. And then we would use the Snellen eye chart. I would have the patient place one hand over one eye and repeat to me the lowest they could see, or the smallest letters they could see, and then I would have them repeat it again, with covering the other eye. We won't demonstrate that here in this video. Then I would check the patient's radial pulse. And at the same time, I would also check the patient's respirations, but I wouldn't point that out because it might alter how fast they are breathing. Alright, so I would also note the rhythm of their respirations. Are they even? Does the patient seem to be anxious? Some people do become anxious during physical exams, so that would be something to note. Then I would take their blood pressure. We won't demonstrate it here in the video, but I would take it on his right arm using a normal adult-sized cuff, as he isn't underweight or overweight. I would do it in the sitting position unless he had some indication of hypotension, in which case we would want to watch for postural hypotension. And we would test it both laying, sitting, and standing. I would also look at his temperature. If I were in the clinic and I had a thermometer with a probe covering, I could take it orally, which is the standard, or I could do an ear temperature, temporal temperature. So, let's see. Next, I would check the patient's pain. So, are you having any pain?
No.
No? Have you been having any pain in the last couple of weeks?
No.
At all? No? Okay. If the patient was having pain, I would demonstrate the scale to them. Probably a 0 to 10 scale, as he's an adult and is able to understand the scale. Then I would ask the patient questions about the pain. Where does it start? What makes it worse? What makes it better? Does it radiate anywhere? How long has it been lasting? How long does it last when it occurs? and that would be the vital signs portion of it. Next, I would ask the patient to change into the gown, which we won't do for the video, but they would come back. First thing I would do would be to check the patient's skin. So I would check the hands at the first part of the assessment. Then I would, for the rest of the exam, assess the skin with each body region, which I will do, but I'll state it here so that we make sure we're covering it. We would want to look at the color of the skin and the pigmentation. Is there red rashy areas? Is the patient pale anywhere? I would also feel the temperature with the back of my hand, look for any signs of warmth or extreme coolness, which could indicate decreased blood flow. I would also look at the moisture. Is the patient overly sweaty, or is the skin really dry? I would also look at the texture of it. Is it smooth? Is it flaky? It's kind of wet and slippery. I would also check the turgor in this patient, see if his skin was elastic. Then I would look for lesions, see if there's any open wounds, any cuts, abrasions, anything like that on his skin. Alright, so first I'm going to inspect your scalp and your head. I'm going to assess the symmetry of his face to look at the cranial nerve 12 or 8. Then I would palpate his temporal arteries. It's kind of difficult with glasses, so I'll move those up real quick. And I would ask him to open his mouth and close it. Okay, that's to assess your temporomandibular joint. Alright. Does it hurt when I press here?
No.
Does it hurt at all when I press here?
No.
Okay. I'm going to do that to check his sinuses. Alright. Next, I would move on to eyes. I'm going to remove these for a moment just so I can see better. I'll put them here. Let's see. I would inspect the conjunctiva. I would look at the sclera, make sure it's white. There aren't a lot of veins. Look at the cornea, the iris, and the pupils. I would note the shape of the pupils, and then I would make sure they were reactive. Okay. I'll give these back to you now.
Thank you.
Okay. Now we're going to do a vision test. So I'm going to hold a hand behind your head, and then as soon as you can see it, let me know, okay?
I can see it.
Okay.
I can see it. I can see it. I can see it.
Okay.
I can see it. I can see it.
Okay. And that's to assess your second cranial nerve. So that's your assessment for the eyes. Next we would move on to ears. So the first thing I'd want to do is just look at them, make sure there aren't any lesions. Make sure the external ears are symmetrical. Is there any tenderness when I press?
No.
No, none right there?
No.
Okay. Then at this point, if I were in the office, I would have an otoscope. So I would check the patient's ear. I would look at the tympanic membrane, make sure it was a pearl gray color. I would be looking for any bulging of the membrane or a red color, which could indicate infection. Next, I would test the hearing, which would be also testing cranial nerve 8. So for this hearing test, I want you to hold your finger by this ear and wiggle it. And I'm going to come from that side, whisper something, and I want you to repeat it back to me, okay?
All right. Monday. Breakfast. Flowers.
Okay, good job. And I would do it for both ears, of course. I'll just do it for one for demonstration purposes. All right, so now that we did the ears, we would move on to your nose. So first I want to check out the nose, just look at it, make sure there aren't any lesions. Just look at the overall shape of it, make sure it isn't largely proportioned or anything like that. Now we need to test the patency of your nostrils to make sure you can breathe well. So I'm going to hold a finger and I want you to breathe in through your other nostril. Okay, and I want you to do it on that side. Good. Any trouble breathing at all?
No.
Okay. So if I were in the office, I would also have a speculum, and then I would look in the patient's nose. I would note the mucosa, see how much there was, see if there was excessive mucosa indicating maybe an infection or allergies. Then I would assess the septum, which separates the nares, and then I would also assess the turbinates on the side of the nose. All right, so that would be my nasal assessment. Moving on to my mouth and throat, I would first have the patient open their mouth. Okay, can you lift your tongue to your roof of your mouth for me? Good. Can you stick your tongue out and say ah? Good. So right now I'm looking at the gums and teeth to make sure they're well taken care of. Check the gums to make sure there's no gingivitis. That can also be an indication whether a person is a smoker. If their teeth are yellowed or don't look very healthy, then that could be a sign to you to ask some questions about it. I would also look at the tongue, make sure that it's not overly dry, that you can't see a lot of lines and indentations through it. I would also check the hard and soft palate, make sure those don't have any abnormal curvatures to them. I would look at the tonsils and grade them. Your tonsils are 1+, which means that they're normal, how they should be, not inflamed at all. I asked the patient to say ah, so I could assess the uvula. In a normal patient, it should quiver in the back of the throat, and yours did. So that's good. And then I asked you to stick out your tongue, and that is to assess your cranial nerve 7. Yep, so that just make sure all of those nerves are working. So now we're done with that mouth assessment. We're going to move on to the neck. So the first thing you want to do is inspect the neck. I would just want to look and make sure that everything, is symmetrical, looks normal. Excuse me. I would want to check around both sides. Then I want to palpate all your cervical nodes. This is to make sure that you don't have an infection. Make sure that your lymph system is good. So I palpate down the front, and the back. Does this hurt at all?
No.
Okay. All right, can I have you shrug your shoulders? I'm gonna check right here. Okay, those all sound or feel great. So next I'm going to assess the carotid pulse. I'm only going to do one set at a time so I don't make you pass out from decreased blood flow. Okay. All right, now I'm going to check for any carotid bruise. Can I have you breathe in and hold your breath? Okay, breathe out. Deep breath in. All right, that sounds good. Now I'm going to palpate down the middle. Make sure that the trachea is in the normal mid position, which yours is. All right, at this time, I would move to the back of the patient to assess the thyroid gland. So if I could have you sit up straight. All right, now in a normal assessment, the patient would have a glass of water and would take some sips. So let's just pretend like you're going to take a sip of water, okay? So you would take a drink, Yep, I would palpate here, and then I would ask you to swallow. All right, and I'll apply pressure to the front right here. One more time, please. Swallow one more time. Okay, good. And if you did have an enlarged thyroid gland, I would be able to feel that. So, now we're going to move on to the back. So we're going to look at the thoracic cage, make sure that everything is symmetrical, there aren't any lesions on the back, the skin color looks good. Just do a general inspection. Then we're going to move on to listening to your lungs. All right, actually, I would want, can you breathe for me? Okay. I want to make sure that you have good expansion. One more time. Okay, now I'm going to check for something called tactile fremitus. So in order to do that, I need you to say 99 for me.
99.
Again.
99.
Again.
99.
Again.
99.
Good. I'm going to palpate here to see. Just make sure there aren't any lumps or nodes on your back. All right, can I have you bend your neck forward? Yeah, and I'm just going to check your spine. Just make sure it's lined up correctly. All right, feels good. So now I'm going to go and percuss through all your lung fields. So first I'll go right here. I'm just going to make sure everything sounds like it should, okay? Can I have you exhale for me? Okay, now during a physical assessment to figure out the diaphragmatic excursion, I would ask the patient to exhale, and then I would mark the edge of their lung border. Then I would ask you to inhale, and I would continue to feel for lung expansion, and I would mark that. I would take a ruler and measure it to get the diaphragmatic excursion. So I'll do it on this side as well. Okay, breathe out all the way. Okay, breathe in, please. Thank you. All right. So now I need to assess for the CVA tenderness. So I'm going to have a hand back here. I need to tell you to tell me if you feel any tenderness, okay? Any tenderness? No?
Nope.
Neither? No? Okay, good. All right, now I'm going to listen to your breath sounds. Excuse me. Deep breath in. Okay. Deep breath in. And again. Again. Okay, sounds good. At this time, I would also be looking for adventitious breath sounds, anything like crackles, rails, wheezing. But this patient is healthy and in for physical, so he does not have any of that. You have clear lung sounds. So now I would move to the front of the patient's chest, and I would kind of do the same thing again. Do an inspection of it. Make sure that when the patient breathes, the chest and the rib cage expand symmetrically. Now I'll have you sit up straight. There we go, nice. All right. Deep breath for me. Good. All right, so I would do the same thing with the tactile fremitus. Can you say 99?
99. 99. 99. 99.
Okay, good. Then I would do the percussion again to percuss all the lung fields. Okay. Okay. Then I would once again listen, but from the front. So, good, deep breath. All right, nice clear lung sounds again. So, now we are done with the chest exam, the thoracic exam. So we will move to the upper extremities. So this will be consisting of the arms. First, I want to check your range of motion of your arms. So I'm going to have you move your hands up and down like this. You can move your arms away from your body, yeah. Just move your hands up and down. You don't have to be forced if you don't want to. Okay, now I need you to move your elbows. Okay, now I need you to put your arms out. Bring them up. There's a light. And then down. Good. And while the patient's doing this, you can put your arms down now. I just want to make sure that the patient has good muscle strength, good range of motion, isn't stiff when they get to a certain part and not able to move past a certain part of range of motion. So then I would check the patient's epitrochlear nodes. So I'm going to have you grab onto my hand right here, okay? And then I'm just going to feel these nodes in your arms, okay? Alright. And they shouldn't be inflamed. You shouldn't really feel a whole lot. Since you're healthy, your lymphatic system's working well.
Good.
Yeah. Okay. Well, that is the upper extremities. Now, the breast exam. Now, you're on a male. You're not going to have to go through like a whole breast exam that you'd have to do on a female. However, you want to sit up straight for me real quick. You do want to just inspect the tissue and palpate to make sure there aren't any lumps. All right, can I have you raise your hand? We'll palpate in your axilla just to make sure there aren't any nodes there. Okay, other side. Okay, so that is the breast exam. Now at this point, I would ask the patient to lay down, and I would help them lay down on the table. Alright. So now we're going to move on to the neck. Move up from the breast to the neck. So I would have a light, a lamp, if I were in a clinic, and I would just inspect the patient's neck and look for any jugular vein distension or any notable pulsations on the neck. Excuse me. Then I would, if indicated, figure out the jugular venous pressure using two rulers to map out the difference. However, it's not indicated on this patient, so we would just make sure, you know, there isn't a whole lot of pressure in the neck. This looks good. Okay, at this point, we would move down a little and look at the heart. So I would just inspect this region of the patient, make sure we can't notice, you know, any abnormal pulsations, any oddly shaped rib cages, things like that. So then I would want to scoot a little way over here. I want to palpate the patient's apical pulse right down here. Make sure. Good feeling. Okay. Then I want to figure out the apical rate and rhythm, make sure that's all normal. And then I want to listen for heart sounds. All right. So I'm going to listen to the base and the apex. And then I would want to turn it to the bell to listen for any extra heart sounds like a murmur. All right, and you don't have a murmur. So now we would move down from the heart to the abdomen. We're going to first inspect it again. Make sure that it doesn't look distended, there's not a whole lot of tension, you know, that there isn't a lot of peristalsis that we can visually see. Then we'll look at the umbilicus. We're gonna kind of feel just to make sure it's flat. Now before we palpate, we're gonna wanna do the sounds first so we don't disrupt the bowels and cause more peristalsis before we listen. So we're gonna listen in each of the 4 quadrants for bowel sounds. Okay, and this patient has active bowel sounds. That's good. Now we're going to percuss the fields here. We're gonna just percuss in the normal quadrants, just going around. Make sure we don't have any, you know, high-pitched sounds that could indicate air in the bowels, or any really dense sounds that could indicate bowel obstructions. All right, and then we're gonna percuss up here for the liver. Okay, we're gonna pass over here. Spleen. Okay, now that we've done inspection, auscultation, percussion, we're going to move on to palpation. So first we want to start off with a light palpation so we don't hurt the patient. Just going to feel for any masses or lumps. And we're going to start with a, move on to the deeper palpation. Do you feel any pain?
No?
Okay. All right, now I'm going to palpate for your liver. So I'm going to move over here. I want to hold one side with this hand as I palpate right under your rib cage. Normally, you wouldn't be able to feel this, and I don't, so that's good. Alright. And I'm going to come over this side and look for your spleen. Any pain over here?
No?
No? Okay, good. Alright, so now if